suffer from unexplained pain, fatigue, or gut problems, to name just a few? All your tests are coming back normal and no one knows what's wrong. Then you'll love this episode with my special guest, Gillian Deakin, family physician for 40 years and author of What the Hell is Wrong with Me, as she sheds light on what your symptoms are now considered functional. Welcome to Beyond Diagnosis, a podcast to raise your awareness, decisions, and voice for alternative practices so you can take back control of your health. I'm Rita De Michele, your host, a mindset and empowerment coach, and the founder of the Onus platform. Join me each week so you can create the health of your dreams. Welcome, Gillian.
Thank you, Rita.
It's such a pleasure to have you here. And really, you have had the most interesting career from Outback Australia to the medical officer at Davis, a research station in Antarctica, and your practice now in Bondi, Sydney, to name just a few achievements. And now, author. Honestly, I couldn't put this book down. It gives awareness, hope, and I believe a voice to the many people who experience these functional symptoms.
That's exactly what I tried to do, Rita. I've been observing humans as a doctor for, as you say, over 40 years now, and I can't believe how many people fall into that gap between good health and having a medical diagnosis. Then you've got these people right in the middle who don't have a medical diagnosis, but definitely aren't well. And it's these people that I'm addressing in my book.
Yeah, and now, God, there are so many. Can you give examples of these symptoms and why have you called them functional?
Look, there's no good word for it. Functional is the best we can come up with. People sometimes say simply persistent symptoms, which means, they're just symptoms but don't have a diagnosis. Some people call them, they've been called psychosomatic. That's a poor term, and we can talk about why it is. I reject that. However, some functional symptoms are psychosomatic. If I get, a catching in my throat when I'm upset about something, that's clearly a psychosomatic response. Everyone would remember that, but many of these symptoms arise out of the blue and people really can't see any association with some process going on in their mind. So that's one reason we're trying to use functional as a catch-all for when all your tests are normal, your body is still working, as in there's nothing medically wrong with it, but you've definitely got a symptom. There can be everything. There can be simply nausea or a headache or fatigue, or you could have something more serious like chest pain, shortness of breath, difficulty walking, even a collapsing. It can be nearly any symptom can be a functional symptom.
And how long would these symptoms need to persist to be considered functional? Would it be like more than 3 months or less than? What is considered? What's that time frame? So someone doesn't think, look, you've just got, an itch in your throat, or you've just got, a bug in your nose that's going to resolve, something like that.
Yeah, well, look, mercifully, many of these symptoms do pass, and so they're still functional, but they're brief. So I could, patient may come to see me with a really troubling little twinge in their side, or a tick in their eye, the eyelid flickering. And then, we start to examine them, we do a test. It's gone away in a week. So if at least a third of people, it's quite interesting, it goes in about thirds. A third of the people seeing me every day have a symptom that for which there's no medical diagnosis for. All the tests are normal. A third of them will persist. So 2/3 of them will get better in a relatively short period of time, and it's just like an annoying distraction. For the third where it persists, a third of them, it's very serious and quite disabling. So that's when, they're missing work, they can't function, it's affecting their relationships. So it's something quite serious. And here's the doctor saying there's nothing wrong with you. Well, clearly there is something wrong. And I want to make that very clear. These symptoms aren't faked, they're not imagined. They're just as real, and often they're more severe than if people have a medical diagnosis.
Yes, especially, something which seems to be more and more these days are like the digestive issues. Those, like irritable bowel or, my mother had so many bowel issues and even, the gastroenterologists and they did all these tests. No one found anything.
That's
And yet
right.
she was always in that chronic pain all the
Yeah.
time. So
Yeah.
that's that really longer kind of
That's
functional
right.
symptom, isn't it?
Yeah, that's right. And as you know, and many of your listeners will know,
Mm.
it can be so severe. And this is where doctors and patients have difficulty, because the patients are saying these symptoms are much more, they're too severe for them to be, and they use these words like imagined. And that's, the symptoms are very real. The body really suffers with them, but they live long and often miserable lives because of these symptoms, but it doesn't shorten their lives. And we've done lots of studies on this. So I just want to say that my book, I'm a GP, I'm not an expert on this, but I have been studying it and listening to the experts. And in the ivory towers, there's a huge amount of research, which I've read over the last several years, and I've tried to distill it into a form that is readable.
Yes.
Yeah.
And it really is. Your book is very readable for the general public.
Mm.
I don't have a medical degree or anything like that, but I've always had a fascination with, you know, health and especially alternative health and things like that. So I found it very readable, and I think so many people will get so many golden nuggets from that. But Dr. Gillian, what bodily changes actually cause these symptoms? In the book you describe and you talked about the seven symptoms
Yeah.
and the restorative and defensive modes. Can
Right.
you give an overview to what you mean there? And is that what actually starts off these symptoms?
Look, I've written the book's 240 words because it is quite complex to explain this, but every doctor in medical school studies these stress systems. They're called the body stress systems. And you're right, I've named the seven of them.
Mm,
So people have heard of the autonomic nervous system. They've heard of the gut biome, brain
yes,
system, they're
yes.
connected. The hormone system, the inflammatory immune system, the skeletal-motor systems. So all of these systems, there's seven of them. All of these systems are the things that keep running our body. And those systems, when they're stressed, and I'll talk about how they get stressed, when these systems get stressed, they produce symptoms. So for example, I'm sitting minding my own business, feeling quite happy and relaxed. Suddenly I'm in a very cold room. That's a stress on my body. My body must respond to that. So it immediately turns on my autonomic stress system and I get goosebumps. I might shiver. That's my little muscles in my skin shaking to keep me warm. My brain system goes, this is unpleasant. This is potentially dangerous. And I take action to keep myself warm. So that's a very commonplace and understandable system. And that's when the systems are working well. But imagine one of the systems under a huge amount of stressors, and I'll come back to mention what they all are in a minute, that system can get disrupted. And you can develop, for example, chest pain. Say the autonomic system is severely disrupted by perhaps a nightmare, perhaps extreme sports, perhaps by just simply overworking and a lot on your plate and never having a downtime, that
Mm,
constant driven, which is really common in the modern, when we're
it
living
is.
such precarious lives. And so the system then can get switched onto the defensive mode, as you mentioned, I've mentioned in my book. and that defensive mode disrupts the autonomic system. And then we can end up with things like a pounding heart or chest pain, even shortness of breath, many, many other symptoms.
So that, or just for our listeners and viewers who are unsure, when you say the autonomic system, are you talking about our nervous system that runs automatically, like we breathe, we digest, those sort of actions that we
Yeah.
don't need to think about?
Yes, exactly, exactly. And so they do run automatically, and they do a beautiful job. They keep us alive in all sorts of conditions, whether we're asleep, we're awake, whether we're active, whether we're still. They constantly adjust second by second to keep us running.
Mm,
And that's a beautiful system. The trouble is that life can upset it. And I'm going to say here that surgery or an illness or a vaccination can certainly disrupt these stress systems, and people can get sick after these things. People are worried that something bad they've suffered damage. And some people are truly affected by vaccines. I'm not saying that they're not, of course they are, but they can also suffer a switching over of their body stress systems, which don't switch back again, and they remain unwell. So the question then is, why does that happen? Well, I've given you one guess, and need to say very early on here, we don't really understand why you might get that reaction and the next person doesn't. We don't understand that. There's a lot for us to yet learn, but I've wanted to open the conversation with my book and start to explain that these aren't imagined symptoms. They're very real, but
mm,
there are things we can do, and so to help to modify that your responses, get you out of that defensive mode and back
yes.
into the restorative mode.
Yes. And I'm pretty sure I read in your book there that you prefer not to say the flight, fight, freeze that so many people do talk about when they
Yeah.
talk about, their nervous system hasn't had is no longer capable of switching over to calm or restorative. Why is it that you don't like to use that term?
Well, those terms are very useful, and I totally accept they're very real, and they're part of the defensive mode when it's operating normally. So those fight, flight, and freeze are responses designed to keep us in a dangerous or threatening situation, to keep us well. So whenever we're under threat. So they're very useful normal responses. The defensive mode does include them, but the defensive mode also includes much more subtle disruptions that aren't included in that. That's why I use a broader term, defensive
Mm,
mode. For example, my circadian rhythm will be disrupted if I'm unwell, or if I'm suffering depression or anxiety. My circadian rhythm goes out the window. That circadian rhythm is the way we wake up and go to sleep. It's run by hormones. That can get totally topsy-turvy, and we wake up exhausted every morning. That links into how our hormone cycle sets. So the hormone, then there's a domino effect. The hormone systems then go haywire. We start to release cortisol and other hormones, which also have powerful effects on our body. So
yes.
there's real changes going on in the body, but the initial causes are often multifactorial, and I keep holding off talking about those ones, but I'd like to get back to that at some point.
Okay, so you would like to talk about the seven stress systems at a later point, or would you like to expand on them now while we're in talking
Let's
about this?
continue expanding on them, but just keep in mind there are several factors that I've identified and many people know some of them, but probably don't recognize how much they have a negative impact
Mm,
on their body. And that's what I want people to really pay attention to that.
yes.
Mm.
What
But
are
they're
those?
talking about the seven systems. So
Yes.
I want people to realize that the idea of getting a functional symptom happens every day. And a very simple, obvious one is when a loud noise happens and we duck, that's an abnormal bodily response to a provocation. So it's a very commonplace one. Again, it's normal. But if your neck ended up stuck like that, stuck down and tight with cramps and headaches and jaw tensing and so on, and you're coming in with, you're suffering with quite a lot of pain, it's possible that your system was triggered into a defensive position very young. Can happen in childhood, and you've got an unpredictably violent parent. Children can kind of keep their head down, and that I've seen it many times. It breaks my heart because I know they're living under an unstable, unpredictable and threatening situation. Very sensible to keep your head down in that environment, but it's not helpful when they're living their adult life and it's still going on. There's no benefit to them except causing them pain and chronic headache and sore shoulders, sore back, many, many symptoms. So it's trying to link up all the dots, and sometimes the dots extend all the way back to very early times in our lives.
So each of these, there's a lot under each one, and I saw that in your book. And if I remember, your book actually stated there was the circadian, there was the musculoskeletal, if I remember that correctly,
Skeletomotor.
a skeletomotor.
The reason we say motor is that the gait can get affected sometimes. So people can end up, they suddenly have a very disturbed gait. I just heard on the radio the other day, I think he was a footballer, famous sportsman, suddenly couldn't walk properly. And it was a functional symptom. He suddenly couldn't walk, and so he had a functional symptom. And I've, really, that's the skeletomotor system. There's the microbiome gut brain system. They all talk to each other, the bacteria in the gut. And I think this is now that information is getting out to people.
Definitely.
We feel that the bacteria in the gut and poor diet disrupting the bacteria in the gut, which affects the gut health, which affects chemicals going to the brain and affects how the brain functions. So that's another. I'm including it in functional. That can be debated, but it's certainly, we know that people, by changing their diet, their symptoms can improve. So that's the gut one. The hormone system I mentioned briefly. What would be familiar to a lot of women is disruption to their menstrual cycle when they're going through change. It could be a wedding or a holiday. It doesn't even have to be a negative experience, but it's something that disrupts your schedule, disrupts your system. Your periods can just go haywire at that time. That's another functional response in the body. Nothing really wrong with the body. It's just that the system has been disrupted by the holiday.
Yes.
Yeah. So am I getting that theme across, that symptoms can arise? Sometimes we can identify the cause, and I need to say sometimes we simply can't. We really cannot find the cause, but we always try to look for them very, systematically. And if we find them, then we try and address them. Most important, I've got patients who live with their functional symptoms, but now they go, it's so much better now because I'm not worried that they're going to kill me. I'm not really worried that I'm going to have a heart attack or something if I get a pain somewhere, So they're able to function much better once they've had this understanding.
Yes, and definitely when people read your book, and they do read about those 7 stress symptoms, and you do actually name a lot of the symptoms underneath each one. That's what I found fascinating, is that you had the circadian, and then, the type of symptoms you can have. Because that is that awareness for people that they can go, you know what, it's not in my head. Here it is. I'm in this one of 7, and I'm feeling that. So I think it's reassuring that someone knows it's not necessarily that they're having a heart attack or they're, heart failure or whatever it is that they're worried about, that it is actually one of these functional symptoms, and, it can be fixed.
Yes. So we do need to be certain that the patients have gone to a doctor and had a proper test and had the possibly blood test, possibly some imaging, appropriate for the symptoms. So if someone comes in to see me with shortness of breath, I'll take a proper history from them and make sure it's not something serious. I'll listen to them. I probably would do imaging or breath tests to test out everything is normal, make sure everything's still working. really important thing is following up and keeping a very close eye on people. But when you work out that everything's working fine under testing situations, but they feel breathless sitting at home alone at night, then the issue of could it be functional? And what I do, of course, is explore that with them and check back in with them. That's really important. So it's see what they feel about this, give them some treatment for it, and then review. So this is a relationship. I have very long relationships with some of my patients. That's one reason why my books are closed, Rita. But I have worked through this with these people and bring them back to health. And sometimes that takes time. It also takes trust. I think we talked briefly about how important trust is before the show, and for them to learn to trust that their body is safe and nothing terrible is going to happen. And I have to be very careful to make sure that's true. But once I've done that, and sometimes they know because they've had the same symptom, for 20 years, and they're still very much with us. There's not many diseases that leave people, in still reasonable health after that long. So time is a friend in that case.
Yes. But that's what I really liked about it, because it's quite reassuring. And, because we have the biomedical model. So it's basically, if you can't measure it, it doesn't exist, which leaves so many people upset.
Yes.
It fails to give a diagnosis, I guess, for these sort of functional symptoms, leaving, I think, the doctor and the patient really frustrated.
That's right.
Especially the patient who, leaves frustrated or even in tears and thinking, I'm not crazy. Someone's got to believe me.
That's
So
right.
when they don't get the diagnosis or whatever, and they're not getting anywhere with their, in that model, in that medical model, what's next for them?
Well, look, I'm hoping we're going to see some things changing soon. I think if I can say, I hope they would read my book. And if they go into the doctor and say, look, you said there's nothing wrong with me, but could it be that I have a functional symptom? I think the doctor would breathe a breath of relief and agree, because many doctors, and there have been studies about this, in the hospital, they've been able to diagnose someone with a functional symptom, but at least 50% of the time, the patients aren't told that diagnosis. And even when they are told, it's told in a fashion that the patients often walk away still feeling it's their fault and feeling like it's somehow they're to blame, and this is a very unhelpful way to describe this to people. So I'm trying in my book to explain why they didn't choose ever to have these symptoms, but there may be things we can do that can help them to ameliorate them and sometimes relieve them altogether. But I'm an examiner for the College of General Practitioners. That means I'm the one who they have to sit in front of in order to become a GP these days.
Oh, really?
So I know the curriculum and I know what doctors need to know to pass. And we've got very high standards in Australia with general practice in terms of making a physical diagnosis. The training is excellent, but what's not in the curriculum is how to manage functional symptoms. And I would love to see that change. In Germany, all the general practitioners are trained in this. They're given several weeks of training in what functional symptoms are and how to diagnose them and how to treat them. But we just don't have that here. And in fact, it's worse in America. There's some change in England, but all over the world, we're facing a lack of skill in the diagnosis and treatment of functional symptoms. So I'm using that word a lot, so people will start to get used to it. And I want it not to be a symptom that they feel any shame about. And I want to say, I've had functional symptoms. I'm a healthy person. I, run and ski and do all that sort of thing. But I certainly have had functional symptoms in my time. So I think it's important that we own this. And it's probably useful to have the idea is that everyone gets them. They can be very mild and trivial, like, as you said, that little tickle or that little twitch that we can have. Then it could persist for, days or weeks, and then go away. But there's some people have them much more serious and much, much longer. So it's useful to have that notion that we're all on that continuum and we need to look at all the factors. So that can cause them.
Yes. Well, I know that my audience are a lot of people who have these functional symptoms. They've gone to the doctor, and like we just discussed, all the tests come back normal. Huge frustration.
Mm.
And the thing is, I interview a lot of functional integrative doctors and also alternative and complementary practitioners because this is who people are turning to
Mm.
because they don't know what else to do. And, they feel that they can get an answer because they
Yeah.
spend more time with them. They
Yeah.
do more testing, more investigation. So going back to my question, which was also what do you think they can do next if the doctor isn't listening? Is it go to another doctor who they think may have, like someone like yourself? Are people
Well,
like yourself easy to find? GPs like yourself?
uh, not sure about that yet.
Yeah, exactly.
Maybe they'll start to read my book and agree. I've had colleagues read it and said it is helpful. One of the things I'd love all your listeners, Rita, to, when they walk out of that surgery and the doctor said there's nothing wrong with you or all your tests are normal, I'd like them very much to celebrate that. That's good news. That is actually very, very good news. There's nothing serious physically, chemically, biologically
Mm,
going wrong with the body. There's definitely a functioning that's the problem. So a good way to think about that is that the doctor has checked your hardware. If you were a computer, your doctor's checked your
mm,
hardware, and the hardware is fine, but you've got a software problem. The program's glitchy. It needs reprogramming. It needs rebooting. Yeah, it might just
yes.
need to be powered down and powered up again. I want you then to leave the doctor's surgery feeling some relief, except that I didn't receive any training in how to treat functional conditions. No doctors really get serious and effective training in this.
Mm,
So then you then go, I am now going to look at, read my book, it's a good start, but to help to understand what can cause these symptoms. And as you go through that list of symptoms, and we can go, let's finally get to that, Rita, and talk about some of those symptoms, some of those causes. As you go through that list, there may be things you've lived with all your life and think are normal, but I actually would say it's time they were addressed and reduced. And often that's all I need to do for my patients. So let's talk about them, for example. I've got in my, there's quite a lot of case histories in my book
yes,
that help to
very
describe what
helpful.
happened to people.
Mm.
So is anyone that particularly strikes you as interesting, Rita? Do you remember any of the case histories?
I
Yeah.
must admit, I am a shocker with names. There was,
Okay. Yeah.
there was a man, had a very short name.
Yeah.
Had a very short name. Unless I actually grabbed the book, sorry.
Well, was he the one that was under quite a lot of stress, slightly anxious man, under quite a lot of stress? He got a big tax bill. Remember him? And he went
Yes,
and
yes,
he decided to go for a walk, but when he was out, he felt kind of like he couldn't quite catch his breath. He felt he
yes,
couldn't
that's
quite
the
get enough
one.
air.
Yes.
So he stopped and started taking some deep breaths, and to his horror, his feet started to go numb. And
Mm,
it really frightened the man, and he called an ambulance and he ended up in hospital. So this is a 45-year-old, very fit man, and he ended up in hospital, and that was all functional. He had managed to disrupt, and I talk quite a lot about hyperventilation in the book because hyperventilation is a really bad, it can cause a lot of symptoms, not just tingling and numbness, but even cramping in the hands, and the jaw can lock, and people's
yes.
whole lips can go numb, their feet can go numb. It's very frightening, but it's all self-induced by over-breathing, too
Mm,
much breathing. So people often think, I'm stressed, I'm going to, take some deep breaths. Too much of a good thing can do this harm. So I always talk about slow breathing, and that, and I like to time it, and I mention how to do that in the book. But I think that's just one example of this man who was a lovely, intelligent, hardworking father, and very capable person, but ended up very distressed. But the doctors discharged him that afternoon. All the symptom had gone away, and he was, he'd spent a very frightening period of time in the hospital, but then was told all your tests are normal. But luckily he was able to take on board what I said about the all those factors conspiring, and him trying to help himself by taking some deep breaths, and in fact making himself worse.
Worse, yes. And that really, so his anxiety around his tax bill, etc., and that really goes back to, what we talk about, the mind-body connection,
Yeah.
and how, we can exacerbate or even create, or trauma can sometimes be at the very base of some of these functional conditions
Yes.
that have
Yes.
the trauma has manifested as a condition or a
Yes.
symptom.
Yes. And what's so interesting is that people can, and I have so many patients that I so admire because they've been able to come through an extremely challenging childhood, with a lot of adverse conditions. And they've made a life for themselves, and they've very successfully done that. They get to a point in life and suddenly these symptoms come up out of the blue. And it's almost like they spent their life climbing out of a very, difficult space, and they finally get to a point where they drop their guard a bit and the symptoms come out. And that's been very interesting for me. And only through doing very deep work and them finally recognizing they're carrying the stress of that childhood all the way with them, and finally getting help with some very deep therapy processing that, those people get better. And there was a lovely woman in my book, I think I call her Kiralee. Most of these names are made up,
I
of course.
remember that name because I thought it was a very interesting name. It
Yes.
actually sounds Aboriginal.
Yes, that's right. So I brought her in because she is someone who was convinced there was something wrong with her heart. She had very nasty experiences at night, and off to hospital again repeatedly, and all her symptoms was around her heart. And it almost makes me cry to think about how much this poor woman suffered with her symptoms. And look, eventually she got help through therapy and with her osteopath, who helped her regulate and turn down, I'll call it here, the fight or flight response, because in her it was very much that. And she was able to perceive how that was affecting her well-being, and she recovered but I want to acknowledge that that was the case. But I have to say, so I'm a conventional, medically trained person. My alternative colleagues, some of them are excellent at helping people regain the restorative mode. To
Yes.
the extent they do that, I have enormous praise and gratitude to them. So I want to just say that I practice yoga. I'm a great fan of yoga and meditation. Both of those things I keep in my life, and they're enormous strengths that I rely on in challenging times. So I do encourage everyone to find a way to regulate their system. And many of us will learn those through some of our alternate healers. And so I just want to, say something to say that I'm not that keen on endless pills, like take this pack, take that pack, mainly because I haven't seen any benefit from that, except in one case, when you really feel a strong connection to that person and that gift of those tablets, you can feel you're doing something good for yourself. And that sense of control and autonomy is really important in how you recover. So it's not so frightening as when you walk out of the doctor's surgery when they've said there's nothing wrong and you're feeling so worried about yourself. So it's really nice when someone takes you in hand and supports you. Anyone who does that and gives you a sense of autonomy, that means, mastery and a sense and a deep connection, I think, is of such an important
That
thing
is
to
so
have.
important. Yeah,
Mm.
connection is so important. And just to clarify on that, when you said pill, do you mean supplement?
Yeah, I'm not a great fan, I'll be honest. I
Yeah.
know a lot of people rely on them. I have many, many patients who take them. I'm not someone who tends to do that, but I I suppose I would be someone who really would like to focus in on diet,
Mm,
and really make sure. And I think you see, I'm play a short part in my book focusing on diet, basically
yes.
saying, we need to have a balanced diet and we need to, whatever that means to people, but we do need the vitamins and the minerals and the fiber and some protein and some carbohydrate, probably. I'm not an extremist with diet. And I do find many different diets work for many different people. So I'm never going to dictate one diet,
One,
but
yeah.
I do like that balance. Mm.
Yes. It's that individual approach. What works for one doesn't necessarily work for everyone.
Exactly, Rita. Yeah. Yeah.
Going back to the emotional aspect that we were talking about, and I'm actually going to read this question to make sure that I say it properly because I was fascinated by this in your book because some of it I've never heard of before. And you use the term the biopsychosocial model,
Mm.
which I hope I said that
Yes,
correctly.
you said it exactly right. So that uh, Dr. Engel introduced that to the medical profession about 50 years ago. So it's been around for long enough for it should have been taken up, and every doctor is aware of it, and we're all trained in that. So biopsychosocial. So it is what it says on that. The bio is the biological side, the part that doctors are really highly trained in, and what you get tested for and treated for in hospitals, and all the tests and all the medications and all the diagnoses that you get from a conventional trained doctor. The psycho is, if I just say psycho, people think it
I
means
know.
mad. So we don't like to use that word because a lot of people who don't have medical background think we're talking psycho as in crazy. Psycho is kind of a adjective referring to anything that affects the mind.
Yes.
So if I'm in the street and there's suddenly a whole lot of violent mob running through the street, that will affect my mind because that's quite a threatening situation. And so my body will respond to that. So that's a psychological thing. Inside my own mind, I can have real demons and real
Mm,
nightmares and really frightening stories that I can dwell on, or I can have real fears about the future, and that's going to disrupt me as well. So certainly we know that the mind has an impact on our whole being. And the social one is an interesting one. It's sort of like if everyone around me is getting sick or everyone around me is kind of older and dying, I'm going to start to be affected by that. We're not just islands. We're very much tuned into other people. That sometimes is very powerful. For example, in, say, girls' high schools where girls are very close and listening and watching each other and learning a lot from each other. And that's fantastic because that's how we socialize and we grow up and learn how to conduct ourselves as adults. But there are times when that can be very disruptive. So in a girls' school, one girl could faint, and then there'll be a whole lot that will faint as well. So
mm,
how does that happen? How does that happen? It's so interesting, and they may never have fainted before or since, but they faint when they see someone else faint. It's not fake, it's real. And so there's a strong, sometimes the social influences can be one of the factors that can affect us. So this is where social media becomes quite a potent agent affecting our health sometimes. So
yes.
I think we should keep in mind that the biopsychosocial model is one that we all should keep in mind when thinking about our own health. So I just thought that's a useful term. What do you think, Rita? Do you find that?
I absolutely love it. I
Mm,
absolutely love that term because it
mm,
is so true. Our social conditioning,
mm,
affects our health.
mm,
The relationship that we have to the people closest to us. You know, we can absorb the way someone else is. You know, like you can be, I personally feel like on the emotional level, I feel that you can be a very happy, uplifted type of person,
Yeah.
and then you're constantly with someone, you know,
Mm.
maybe they're in your immediate family or whatever,
Yeah.
who's quite down and quite
Yes.
negative. And
Yeah.
after a while, without even wanting to, you have absorbed
Yes.
a lot of that energy, and all of a sudden you're feeling down, and all of a
Yes.
sudden you feel heavy and your
Yeah.
shoulders hurt,
That's right.
or you're getting more headaches, or
Yes.
you know you're grumpier, and then that
Yeah.
you know creates other things. So I absolutely love that model because it
Yes.
encompasses everything,
Yes.
you know.
As
And
a GP who's been a GP for a long time, I've seen people with, migraine after migraine after migraine, and we try this and we try that and we try that. They change jobs. They get rid of the toxic boss. The migraines go away. You go,
it is,
why didn't we think of that? They hadn't really revealed to what extent they were struggling at work, and that was, I've often felt bad that, we've never get to the cause like that. And that's,
yes,
um, so yeah, it's we do need to look at everything, and people should not underestimate how potent the impact of those things can be. And I think this is the problem, that medicine has been so successful in diagnosing amazing stuff and treating amazing stuff, HIV and cancers, melanomas. Who would have thought that we'd be seeing this? And I'm just so, proud to be a doctor as part of that tradition.
absolutely, yeah,
But it's cost people who are suffering functional symptoms, because doctors and patients alike are totally addicted to the testing and the treatment like that, and ignoring the cause of symptoms that come from where we can't test.
yes, yeah, absolutely. And that's what I loved about this biopsychosocial is
Mm,
it's also from reading that section in your book gave me great awareness
mm,
also that as a patient, don't just look at what you're experiencing in silos.
yes,
You know that yes, you may be experiencing a gut problem. It may not be just what you ate, or it may not
yeah,
be whatever. It may be the environment you're in.
yeah,
That
that's right.
stress of that environment for you
Yeah.
affects your gut.
Yeah,
For
well,
someone
just
else,
as a doctor, I want to say that categorically that can be the case. Of course, you need to do your tests, and there are things you should have done. But when you get the functional diagnosis, there's a lot of doctors go, well, what if it's not a functional condition? So we've done studies on that, and I'll let people know that when you get given, somebody's done all the tests, you get the diagnosis that it's functional, could that doctor be wrong? They're as wrong as often as they are with other diagnoses. So it's about 3%. So it's actually very low. Okay.
mm,
It's very low. So we consider that very low. So 97%, they're right on the money with the functional diagnosis. So you should just test that out and say, okay, if it's functional, what do I do now? Now, the doctors, I'll be honest, I had a doctor ring me the other day, and he diagnosed someone with that globus thing, that tightening in the throat, which is a really unpleasant symptom. And this guy was he was a spine surgeon, and the patient had gone to him saying, it must be something wrong with my spine, it's choking me or something. It wasn't. It was a functional symptom, a tightening of the throat muscles. But he didn't know, he got the diagnosis right, but he didn't know what to do with it. So, just as a big hint, the speech therapists are wonderfully skilled in treating that. So if you ever get stuck with that sensation, it's quite unpleasant. And the speech therapists are very good at helping. So I just want to put a plug in there for my allied health practitioners. And so speech therapists are very good. Physiotherapists are wonderful. And also the psychologists play a big role here in just helping us to understand where we are in our life at this moment.
mm,
And, when I was a lot younger, I was not aware of some of the stresses I was under. But later I went, I went to Antarctica. So I was going
yes,
away with, 100 men. I was the only woman on the station for the winter. I was going to see my family for a year. I couldn't leave the place. And I had to set up my research, which meant I had to remember everything for the whole year. So it was a lot on my plate. And I got a stress symptom. And I remember going somewhere and getting something, and the chemist said, "Oh, you must be stressed." I went, "I so am not,
How dare you?
So, afterwards, I was able to go, he was probably right.
That's right.
And so now I can laugh about that. But I think, at the time, sometimes we're in the thick of something, we can't really see how much it's costing us, not necessarily mentally. I was on top of everything. I had everything organized. I had the whole thing packed and I was all fine, happy as anything going. But I have to admit that probably on one level in my body, I think it helped. It had an effect on me. So I just want people to realize that sometimes I feel that the body is not as powerful as the mind. The mind says, "I'm going to do this. I'm going to push through. I'm on top of this. I'm fine." Your body's going, "Honey, I'm not into this. This is just too much. Give me a break. I want a sleep. I want rest. I want relaxation." Yeah. And I want a decent meal eaten in a calm and quiet environment without everyone,
Yeah, but sometimes we just don't listen, do we?
That's right. That's the critical thing, Rita. We don't listen. Yeah, that's a
Yeah.
really important thing to hear you say.
The other thing that was actually in that section of the book, just if we could just touch on quickly, which I found absolutely fascinating, is you talked about the placebo and the nocebo effect.
Yes,
Never heard of nocebo before, but I thought it was absolutely fascinating in,
yes.
knowing could you just touch on the difference and what you mean by nocebo?
Yeah, sure. So it's so funny, isn't it, that most people do know about a placebo. So if
Mm,
somebody gives you a pill and say, "I really think this is going to help you," and you have faith in them and you also want it to help you, that's important. The
yes,
placebo will help you quite a lot. It's not 100%, but it's good. So that's placebo. The evil twin, I like to call it, of placebo is nocebo. And nocebo, Nocebo, nocebo is when I'm going to give you something, it could cause these side effects. So just take it because it'll help your infection or something, but you might feel nauseous, you could get a headache, you might break out in a rash. If you get symptoms from that tablet, some of it could be due to the actual side effects. Some of it's due to nocebo. So that's amazing. So those symptoms could be just ones that have developed in your body, the headache or the nausea. They're real symptoms, but it's caused because of this effect, this nocebo effect. So in other words, there's a deep part of your body that understands these symptoms could arise, and then they're predicted and they arise, and then you've got the symptom. So we've proven this by giving people a plain tablet. I'll call it a placebo tablet, so everyone knows what that is. A tablet that's inert, it's got, like sugar in it or something, something quite innocuous. 100 people were given the tablet and were told no side effects to be expected. Another 100 was given the tablet, were told all this list of side effects were expected. Everyone can guess which group got the side effects, right? Everyone can guess. The same tablet, one group got the headaches, the nausea, the rash, other things, yeah?
nocebo one.
So the nocebo effect, it's very real, it's measurable, we've all suffered it, and it's possible that some people who suffered some of the things that we know they suffer are suffering from nocebo. So I think it is a very interesting thing. I don't ever read those. Unfortunately, I know too much of the lists of the side effects, but I don't encourage people to read those lists in their packets, because some people will get them simply because they read the side effects.
So that goes into the psychosomatic sort of symptoms, which
Mhm.
are different to the symptoms you are experiencing as functional, wouldn't you say? Because a lot of the frustration for people who have the functional symptoms is that people keep saying it's just in your head.
Yeah. Well, look, I think I would put functional, I'd say psychosomatic is part of functional, right? So,
Mm.
for example, if a child runs in front of my car, I'll go, and I'll get tingling all over, right? And everyone will know that would be a immediate psychosomatic response. I got a very big fright and my whole body tingles, right? And as I break it. Have you had that feeling when your whole body tingles
Absolutely.
when you've had a fright?
Absolutely.
So we accept that psychosomatic. A very frightening thing happened. My body reacts. I get the tingling. Yeah, psychosomatic. What happens if I wake up and I'm tingling all over? Right? What happens then? I've not frightened a car. I've just simply woken up and I've got to go soon. Okay. I've simply woken up and there I am tingling all over. It's much harder to prove that psychosomatic, and I would never presume, but I do know that can be, it could be something seriously wrong with your body. You do have to see the doctor and get checked out, but it could be functional. Okay. So get checked out first and then look at all the causes. So
And I can see that you need to go. So
yeah.
if I could just ask you 2 questions very quickly,
Yeah.
maybe you could just, do
Sure.
bullet point kind of
Okay.
talk here.
All right.
What are the 6 steps to treat functional symptoms?
Right, I'll try and remember them. But so the first one is get a clear diagnosis. If you get a symptom, make sure the doctors have ruled out a serious medical or even a minor medical diagnosis. So you're clear you've got a functional symptom. You've been told that. The second thing is then to really understand what all the potential causes are. So that you'll read that in chapter 3, really, in my book, all the potential causes. So we'll leave that hanging and you'll have to read about that. And then the third step is, can you remember?
No. Yeah, it was information overwhelm for me.
It was overwhelmed, wasn't it? Yeah, it was overwhelmed. The next step is to look at which of your systems are affected. So, you might have your gut affected, or you might have your skeletal-motor system affected. To work out which, and you could have several symptoms affected, so systems affected. You've been saying symptoms, and I just said it. It's systems. So the skeletal-motor system or the hormone system, you've got to work out which of your systems are affected. Try and make a clear list, step 4, of all the potential contributing factors. Build your team, step 5, build your team. So who's going to help you to address each of them? If it's your gut, you're going to be using a dietitian, or look at your diet and eat calmly and eat regularly. If it's your body, you might find someone who can work with your body. And step 6 is really then trying to step through all those things and practice.
That's fantastic. And I won't ask the last one because that's about advocating for yourself. And you did just mention a bit of it there.
Yes.
And it is very important for people to advocate for themselves and find a practitioner that they relate to, and to really be in the driver's seat of their health by becoming aware and by reading your book.
Rita, it's been such a pleasure talking with you.
It's been such a pleasure.
Enjoyed it. Yeah.
Could you please let our listeners and viewers know how they can get a copy of your book?
Sure. So I'm selling it on ebook. You can go online. What the hell is wrong with me? You can go to my website, which is whatthehellbook.com. And you can order it online. And sometimes I'll be going to bookstores or to clubs or places. If you want me to come and speak, I can certainly do that. And your favorite bookstore, Booktopia, or Amazon, whoever you like to use, you can order it as well.
Lovely. And Dr. Gillian Deakin's details will be in the show notes, her website, her socials, and where you can buy her book. Honestly, if you have a functional condition, do yourself a favor and get this book. It is so inspiring. Thank you so much for coming on the show.
It's been a pleasure, Rita. Lovely to meet you.
Lovely to meet you.
All the best for your listeners.
Thank you so much.
Okay. Pleasure.
I would love to know, what was the biggest insight or aha moment you got from this interview, so you can now speak up, take action, and make informed decisions for your health. And if you like this episode, get instant access to your free ebook, Alternative Wisdom taking back control of your health at life-onus.com.